We're coming to you with breaking medical news. Could a diabetes drug be a game changer for weight loss? A new clinical trial is giving millions of Americans struggling with obesity hope. And it couldn't come at a better time because obesity is a significant risk factor for severe illness from COVID-19. So today, we're going straight to the source. Dr. Robert Kushner, an obesity researcher at Northwestern University, a good friend of mine. He actually ran this groundbreaking clinical trial. Dr. Kushner, thanks again for joining us.
Yeah, first of all, thanks for having me on. I don't use the word game changer very often. In fact, it's the first time I've used it in my 40 years of practice. This medication is 1.5 to 2 times more effective than any of the currently available medications on the market. Patients, on average, after 68 weeks, lost 15% of their body weight, and that turned out to be 34 pounds from starting weight. And more exciting, Dr. Oz, is that a third of the individuals in the study lost 20% of their body weight, which was about 46 pounds, which is really an amazing amount of weight loss.
Just to put this in context here, 33 pounds, right? That which was the average over the 17 months of the trial. Oh, you see this cinder block, everybody? Right? You haven't done construction recently, I can tell you this is pretty heavy, right? 33 pounds. Imagine losing this from around your waist. That is the amount of impact of a medication, which, again, I got to say, I was stunned by as well. I never anticipated those kinds of benefits.
And it's it mimics GLP-1, which is a gut hormone. Now, we've known about gut hormones for quite some time. Most of them increase your insulin response to sugar, and that's why they've been used quite a bit for diabetes. But at higher doses, they also affect one's sense of hunger or fullness. So when you eat a meal and you feel full, don't want to eat anymore, part of that is a release of gut hormones. GLP-1 is one of them. And not only does it slow your stomach from emptying, so it gives a sense of fullness, but even more importantly, it has receptors in the brain, which is the appetite centers in the brain, which has to do with hunger and fullness and thoughts of food and so on. So when the same drug, which is used for diabetes, is used at higher levels, the weight losing effect, the appetite controlling effect really kicks in. And that's why this drug is much more effective than the drug currently on the market, which is for diabetes.
Now, of course, there are no magic bullets when it comes to weight loss. And these trials and the participants in them made lifestyle modifications. It has to do with these special receptors found in many organs. Now, before you go to them, here's the stomach, the liver, the intestines. All these organs have to respond when you eat. So normally there are receptors on these that are activated after a meal, right? And every one of these has a role. And that increases the amount of insulin you make, which, as you know, is important to digestion. Now, let's go to the stomach. Right? It actually takes the stomach and it slows gastric emptying, which means the food stays in the stomach longer. The stomach distends, right? And guess what happens when your stomach is full, right? You feel full because that's what it's all about when you eat food. That's why you feel full. Now, these same receptors are also found in the brain, and they release this hormone that causes you to have a decrease in appetite. It's called GLP-1. The result? You feel less hungry, right? So you eat less food, which could lead to weight loss. That's the goal for so many folks.